Take a look at this story. Now, hopefully I don't get blocked again because they've been blocking everything that I've been putting out as far as this type of stuff, but I'm just reading a story here. Department of Justice states that jobs can require employees to get COVID-19 vaccines to return to work. The Department of Justice has now made it clear that there's nothing wrong with private businesses and public agencies requiring that employees get the COVID-19 vaccine in order to continue to work. Okay, so why do I care? Why are we after this? And why can I not highlight this here? Let me see. Oh, I can. Okay, so I can grab this piece right here. What does this say? It says, the Department of Justice has now made it clear that there's nothing wrong with private businesses and public agencies requiring that employees get the COVID-19 vaccine in order to continue work. Okay, well, there's nothing wrong with that, but there's also nothing wrong with the employers not requiring the vaccine. You know what I mean? So why are we saying that? Why are we saying this? Like, what kind of pressure are you going to add to those businesses so that they can require the vaccine? Because we know that's what the Department of Justice wants, ultimately, is to sell as many vaccine units as possible for some reason. The Department of Justice announced that it is okay if businesses require workers to get the vaccine under emergency use authorization by Section 564 of the Food, Drug, and Cosmetic Act. So they're reaching into the Cosmetic Act. So it says, in light of these developments, you have asked whether the option to accept or refuse condition in Section 564 prohibits entities from imposing such vaccination requirements while the only available vaccines for COVID-19 remain subject to EUAs. Read the announcements. We conclude, consistent with FDA's interpretation, that it does not. This language in Section 564 specifies only that certain information be provided to potential vaccine recipients and does not prohibit entities from imposing vaccination requirements. Okay, so like your employer is the entity and they can impose vaccination requirements because Section 564 does not protect you from that. That's interesting, but they also don't have to require you to have a vaccine as well. You see what I'm saying? Even under this interpretation, which I'm not saying is true. This is just their interpretation of what they're saying. It says, if an employee has a disability, oh, by the way, where we say we conclude consistent, okay, so they have to, the potential vaccine candidate imposing such vaccination requirements here, it says we conclude consistent with interpretation that it does not, blah, blah, blah. I think it says somewhere right here where it says potential vaccine recipients. It says right here, this piece right here, I think. It says the language in Section 564 specifies only that certain information be provided to potential vaccine recipients. So certain information be provided, such as adverse side effects, such as the VAERS website, you know, such as doing research on the VAERS website, which is basically a website where they are supposed to be counting adverse side effects from vaccines, but I wonder what they're doing with those numbers. It says, if an employee has a disability or religious belief that interferes with them getting the vaccination, reasonable accommodations can be made under federal laws as well. Yeah, reasonable accommodations only if the employer supposedly chooses to enforce their employees to have vaccinations. They also don't have to require the vaccination. Employees will have 8 weeks from being notified to get the vaccine. Oh, really? So it says the Department of Justice and the U.S. Department of Health and Human Services also released a statement regarding the long haulers, or those who still experience symptoms after no longer being diagnosed with COVID-19, being considered as people with disabilities under the American Disabilities Act. So once you're already ravaged and basically the vaccine could harm you, because of this, then you automatically fall under the Americans with Disability Act and you're protected from taking any further doses. Well, how convenient. Some individuals recover quicker from COVID, but others experience debilitating long-term impairments that substantially limit major life activities. Acting Director, of course, Robin Sue, or Fro Bose of HHS's Office of Civil Rights, said, "Today's guidance makes clear that these individuals are entitled to equal opportunities and full participation in all aspects of life." This announcement comes as the Delta variant of COVID-19 spreads at a high rate throughout the U.S. and the black community hasn't been getting vaccinated enough. Okay, that's kind of scary. They haven't been getting vaccinated enough. But then also, like, how do we know that we can trust this statement that the Delta variant is spreading at a higher rate throughout the U.S.? There's so many holes in all of the information that we've been seeing over the past year about their reporting. It's almost like crying wolf. Like, how do we know this time is real? How do we know what is happening here? Unfortunately, the black community is lagging behind in COVID vaccinations, and as a result, is experiencing higher rates of infection and hospitalizations. Well, where can we go see these numbers that these organizations that are making these claims are punching these into their computers, and hopefully not like punching in the wrong numbers? Dr. Elaine Batchelor, the president of Martin Luther King Community Healthcare, told the Griot, "Let's not allow this terrible disease to disseminate our communities again." So what about adverse side effects such as death? Maybe that'll slip somebody's mind here. With this Department of Justice jobs can require employees to get COVID-19 vaccines to return to work. They can require, but they don't have to require. So does that look like a strike coming? Because I'm serious. So here's the Department of Justice. Here's another one. I'm going to try to jam this one in real quick. Department of Justice says it's legal to mandate COVID vaccines. Okay, it's legal to mandate COVID vaccines. Okay, so how would that be carried out? The Department of Justice on Monday published an opinion indicating that coronavirus vaccine mandates are legal despite only being approved for emergency use. The judgment was brought to light as areas across the country have either mulled or implemented shot mandates in some capacity amid a surge in cases. See, here we go again with surging cases. Like, how can that be verifiable? How can you inform potential recipients of experimental vaccinations under emergency authorization that those figures are being collected correctly? The Food and Drug Administration's emergency use go-ahead does not prohibit public, so it's or private entities from imposing vaccination requirements. Here we go. For vaccines that are subject to EUAs. And I don't know what EUAs are still. It says the Department of Justice Office of Legal Counsel wrote, "Citizens have a right to be informed of certain information, including the option to accept or refuse administration of the product. Though businesses, government, and other entities are not prohibited from requiring doses from Pfizer, Moderna, Johnson & Johnson, all of which have received only emergency use authorizations," the Department of Justice added. So basically, I want to know, my question is, after this, what kind of pressure are you going to start to apply to these entities so that you can make it hard for them to basically say that they do require vaccines for their employees? Basically, what are you going to do? Because that's what I'm looking for now. I'm looking for what is going to happen next. What can the federal government do to make it hard for these entities, which are basically employers, to basically not have their employees take vaccines, if that makes sense? Pretty much, what kind of pressure are you going to apply to these entities so they can do your will? That's what I want to know, because they keep writing it in a fashion like, oh, they could require you to have a vaccine, but they also cannot require you to have a vaccine. It's up to the entity themselves, especially for an experimental vaccination that's under emergency authorization. in which we don't have reliable data, especially from the media who cries wolf every other month or weekend. It says, none of these shots have been given a set date for full FDA approval, but I'm pretty sure you'll rush that through, especially for 12-year-olds, right? It says, though health officials, including Dr. Anthony Fauci, President Joe Biden's chief medical advisor, are confident that the vaccinations will be given the okay. Oh, we get cap letter. Oh, we get caps. Okay, from the government body. Oh, okay. It says, however, both federal and local entities have opted not to wait for the FDA to mandate vaccinations. Okay. So, however, federal and local entities have opted not to wait for the FDA to mandate vaccinations. That means they don't want to wait to see if there's going to be adverse side effects or look at who most likely will experience the most intense types of adverse side effects, one that includes death, as being the maximum. On Monday, the Department of Veteran Affairs became the first federal agency to mandate COVID-19 inoculations for employees. Title 38 personnel, including physicians, dentists, registered nurses, and others, will have 8 weeks to become fully vaccinated against the disease in compliance with the new policy. Okay, so now they'll be the first ones under what they claimed are, to require vaccine. I feel bad for these people. To require experimental vaccinations be taken by these employees to work there. And they go on to say, we're mandating vaccines for Title 38 employees because it's the best way to keep veterans safe. What about vaccine shedding? Does that keep people with immunocompromised systems safe? That's just a question. I'm just asking a question. I don't want this to be banned under misinformation from YouTube, but I'll try again. I'm not making any accusations. I'm reading and I'm reading a story and I'm having an opinion here. It says, especially as the Delta variant spreads across the country. So now we have another mutation that's taking place, right? Because viruses do mutate, and their generations are faster. So I'm wondering if the vaccine can protect you against different variants and by how much. Do we need to complete studies in order to figure that out? Or are we just going to claim that nothing is wrong? Nothing is wrong with anything here. Nothing's wrong. VA Secretary Dennis McDonough said in a statement, whenever a veteran or a VA employee sets foot in a VA facility, they deserve to know that we have done everything in our power to protect them from COVID-19 with this mandate. We can once again make and keep that fundamental promise. What about vaccine shedding? Okay, that's what I'm asking. What about vaccine shedding? If they're shedding after they took a vaccine and there's a immunocompromised veteran next to them, can they get sick? Can they catch the virus? Will they experience side effects? That's my question. It says early on the same day, New York City Mayor Bill de Blasio, because we know he's such an upstanding, upright politician, announced that the Boroffs would require all city workers to be vaccinated or subject themselves to weekly virus testings. So either you get the vaccine or we put you through uncomfortable testing rigorously, right? So that's how we're going to basically make it inconvenient for you until you try to make it convenient for yourself. It says, by taking the vaccine, of course. It says, roughly 340,000 workers, teachers, and police officers will be under the requirement, which takes effect in September. September is the pivot point of the recovery. The Democratic mayor explained at a press conference on Monday, and so on September 13, the first day of school, every single city employee will be expected to be either vaccinated or they will be tested weekly. Also on Monday, California Governor Gavin Newsom said, another upright standing politician with no issues in their policies whatsoever, no other morality like compromises whatsoever, who is just so upright that they're ethically correct in all they do. Yeah. So we go from New York to California, right? Those are our two example states that we're using here. Gavin Newsom said that all government employees and healthcare workers will be required to show proof of COVID-19 vaccinations or face weekly screenings, or they will be inconvenienced. They will be put through they will be made to be inconvenienced. And they'll need to show their papers, please, of their medical health. Okay, so he said on Monday that the Golden State will have the strongest state vaccine verification system in the U.S. Well, I'm glad to hear that another liberal, collapsing to the ground state who's also eager to sell out so quickly will have the best, strongest, basically surveillance for your health system in the state. We're experiencing a pandemic of the unvaccinated. So we're seeing this term being marketed here. Pandemic of the unvaccinated. So they use this language here. This is the new marketing term that they're pressing out. And you'll see the same thing, pandemic of the unvaccinated, through different news sources, through different types. They look like different outlets, but they're the same outlet. They just have different brand names, and then they market these terms to you. So we are now experiencing a pandemic of the unvaccinated. The only problem is, besides the VAR's website and other places where they collect data for like backing up their story here, like I'm not sure that they're making that publicly available. And then when they do make that available, why are they the ones basically putting the numbers in the system? And then when they're the ones putting the number in the system, and then they say, believe me, I put the right numbers in the system. This is exactly what we're doing, even though we cry wolf all year and all 4 years before that in the last administration. And we're showing how vicious we are with our teeth and our lies, but somehow you should be convinced that what we are saying is true. There's no such thing as adverse side effects. There is no such thing as that. There is not one thing. There's not one thing wrong with what we're requiring here, right? So we don't even have to bring up anything. We don't have to bring up anything that could be wrong with what we're trying to do, because because it's basically utilitarianism. The individual doesn't matter. It's all about the collective, the same thing. So it's got socialist properties, it's got communistic properties, like do what I tell you to do. You have no rights. That is the message here that's being marketed under pandemic of the unvaccinated. Blame people that don't want to take experimental vaccinations released under emergency use authorization, in which there's no solid data that interprets the type of adverse side effects that may occur. Don't worry about that at all. You don't need to ask those questions. That's misinformation. Even though you're just asking the question, even though you're just asking questions, that's considered misinformation and will be, you know what, on all the different platforms that you can share information. Everyone that can get vaccinated should, okay? So if you can get vaccinated, because we don't even know in what case that you cannot be vaccinated, because we're not seeing the data of the adverse side effects from specific genetic sequences from individuals, or what kind of underlying health conditions in which could possibly trigger adverse side effects. We don't know that. We don't have any data about that. So I'm going to attempt to put basically me reading this mainstream, article again up on my channel, and see how long it lasts before it gets banned and I get a community strike for just asking basic questions about this public piece here, this public release, this PR piece here. Because anybody that has ever worked in PR knows that PR never lies to you. Public relations never lies to you. They always tell you the truth. They always give you room to ask questions. So we'll see how long this stays up for, but I'm going to go ahead and end it right here.